team A, it's
Sir, Anuja's connection lost, sir.
ask her to connect. We have not yet started.
Okay, sir.
She joined.
No, sir. Sir, allow பண்ணுங்க, sir.
Yeah. I think we can start. So we have selected now the four teams. So team A is Akshaya P and Akshaya A. Team B is Anuja and Sangeeta. Team C is Arunachalam and Kamalakannan. Team D, Aparjita and Swati Bala. So before going into the quiz, I just wanted to wish you all the best for all the teams participating today. So one of you will be selected out of this, but again, the losers need not feel bad because you have done a great job coming to this level. So today it's just going to be easy questions only. You're just going to learn new things. The one who is going to perform well is just going to get selected. That's it. So this is not the final. Okay. So now I'll just orient you towards the rules of today's quiz. So there are a total of 6 rounds. The first 3 rounds, it will start from team A and proceed to team D. The last 3 rounds will proceed from team D to team A. The time given for each direct question is 15 seconds, after which the buzzer will be rung. Answer given after the buzzer will not be accepted. An extra 5 seconds for other teams to send the response to the past question through chat. It's actually a private chat to Dr. Azhar, who is also in the meet. So what I would advise all the team members, that is those who are not answering the direct questions. So the rest of the 3 teams can start to type your answers and send it to Dr. Azhar. So the extra 5 seconds is just a buffering time. So you will not be given more than that. And any answers sent after that will not be accepted. So if 2 or more or even one team answers the correct question in the pass round, you will get 5 marks. The direct question will fetch you 10 marks. There are no negative marks for wrong answers. And remember, you are supposed to give only one response. Okay, so you cannot give multiple response. Whatever you give as a response as first will be taken as your final response as well. Okay, so as I told you, the past question will just be giving you 5 marks. Okay, so there are certain questions where you will be having 2 parts. Okay, so the 2 parts, if you answer the 2 parts correctly only, you will get the full marks. Okay, so this holds good even if it is going to be a past question. So if a past question, if the two-part question gets passed, you will get the 5 marks only when you answer the 2 parts of the question. Otherwise, you will not be getting the full mark. And remember, only one person in the team should answer. So here we have 2 teams who are not together, right? So see to that there is no confusion between the 2 persons who are participating. Only one person has to give the final answer. Okay, and you cannot change your answer. Whatever you tell first will be taken as the answer. So it cannot be changed later. Coming to the second part of the rules, actually, if there is a tie, say between the top two teams, there will be a tiebreaker round, and the details of which will be shared later if need be. And kindly don't give any excuse for technical glitches. Once the question is underway, we are not going to stop for anyone, except if there is going to be a significant problem from our side. So see to that there are no technical glitches. If any of your partner gets disconnected, especially for those who are sitting separately, see to that the one who is available should give the answer. Okay, and remember the quiz master's decision will be final in case of any queries or any doubts in the question, and in case of any technical issue from our end, the quiz master and the coordinator will decide as to what to be done. And as I told before, there will be one winning team that will be selected to represent our college in the next round, that is the divisional round. Okay, so is there any if you have any other doubts, you can again clear it, or you can just show me a thumbs up if you are okay with whatever I told now. You can just show me a thumbs up so that I will infer that whatever I said been communicated correct. Yeah, tell me.
Can we use a note and a pencil for writing down the options?
uh, Actually
In case of sequence questions, we have if you have to.
no, it is not going to be a multiple choice round. You will be expected to answer directly as a fill in the blank or an answer only. You will not be given any options for this round. So only for your prelims we had a multiple choice. Here you won't be having a multiple choice. Okay, so no point for writing. You can just whatever answer, if you are in a past team, see to that you type and send it to Dr. Azhar. Only if the team that is going to answer direct question doesn't answer, your answers will be validated. Otherwise, it will not be validated. Only when the team doesn't answer, it will be validated. And remember, whenever I'm calling for the team to answer, automatically please unmute. Okay, all others be in mute. Only the team I'm calling for should unmute and should give the answer. Okay, remember we'll be strict with the times, so see to that you're answering it within the time. So there will be 15 seconds for the direct team and the rest for team extra 5 seconds. Okay, so shall we start? Okay, so team A, actually I have just ruled out one option in this. You have options 2, 3, 4, 5 and 6. You don't have the first option. You have options 2, 3, 4, 5 and 6. Team A, Anuja and Sangeeta. Sorry, Akshaya. Akshaya, what option you are choosing?
3, sir.
Option 3. Fine. So the anatomical closure of ductus arteriosus occurs by dash weeks. Your time starts now. Five seconds more. Sorry, time's up. Rest of the teams. Sorry, your time's up. Other teams can also stop it. Okay, don't send, it will not be evaluated. So the answer is 3 weeks. Okay, so answer is 3 weeks. Why 3 weeks? Okay, so now so now the
Which team?
teams.
Tell me.
So team C, I think they have got it right. So Arunachalam Kamalakandan, team C will be getting 5 points for this question. So now coming on to team B, Anuja and Sangeeta. Unmute.
Yes, sir.
You have options 2, 4, 5 and 6.
2.
Your answer is, your option is 2. Okay. Okay. One mistake, sorry. Arunachalam, I didn't think, I don't think they gave the right answer. Okay, I think they gave the wrong answer. So for the last question, no one gets the right answer. Okay. So their answer was also wrong. Sorry. So the first question is not answered by anyone. So now team B are choosing option number 2, right?
Yes, sir.
Random inactivation of X chromosome is called, and your time starts now.
Bare,
One of
bare
you give-
body. Bare body. Bare body, sir.
No. So the time's up. Your responses after this will not be recorded.
Team A has
I
answered
told
correctly.
bar body, I told.
Yeah, that's not right. That's not right.
Team A has answered correctly.
So team A, Akshaya, Leon hypothesis. That is what is the answer expected, and they have scored 5 points. So now for team C, Arunachalam and Kamalakannan, you have options 4, 5, and 6.
5, sir.
5. Genes regulating synthesis of alpha globin chains are located in chromosome dash and dash. 2 answers expected. Only when 2 is right, you will get the full marks. Your time starts now.
Kamal தெரியுமா?
16 chromosome 16 இன்னொன்னு என்னன்னு தெரியலடா. chromosome 16 and then 4 போடுறியா இல்லனா 5 போடுறியா தெரியல எனக்கு. 16 தெரியும்னு நினைக்கிறேன்.
16
Or
and
your
5.
time's up.
16 and 5.
So the other teams also don't send your responses after this bit. That's it.
A
So
and B
it's-
has answered.
So
A
team
and B has answered correctly.
team A and B have answered it right. It's actually chromosome 11 and 16. 11 and 16. So your 16 was right, but you didn't choose 11. So that's why you're not getting the marks. So team A and B are getting 5 points. So now the last question of the first round. So it is going to be for team D. You have options 4 and 6. Aparjita.
Option 4, sir.
Tam horseful protein originates from. Your time starts now.
Kidneys. So kidney.
No. So other teams also, your time is up. No one has answered it right. The answer for this is ascending loop of Henle. So that was the key expected for that question. So that is the answer expected. So I think we have come to the end of round 1. I would like to ask Dr. Azhar, who is the timekeeper for this and the scorer as well, to just give us an update on the marks scored in the round 1.
So the end of round 1, team A, Akshaya, B and Akshaya S has scored 5 marks. Team B, Anuja and Sangeeta scored 5 marks. Team C and D yet to open the phone.
Answer one more question also.
Yeah.
Share 10 marks.
Yeah, Akshaya has 10 marks.
10.
It's 10 marks for Akshaya. Yeah.
B is 5.
So now we'll proceed for the next round. So round 2, the team, we are going to again start with the team A only here also. Okay, so team A, Akshaya, this round is on general pediatrics. So what is your option, Akshaya?
So number 6.
A 2-year-old child is brought to the outpatient department with features of hand-wringing stereotyped movements, impaired language and communication, breath-holding spells, poor social skills, and deceleration of head growth after 6 months of age. what is the most likely diagnosis? And your time starts now.
Rett syndrome.
Yeah, she's right. So I think you will not be having a pass for this. So her answer is right. It is Rett syndrome. So you get the full marks for this question.
Okay. Ready. Ready.
Wait a second.
Round 3
Wait a second. Oh, just wait a second.
autism spectrum. Autism disorder. கடைசில பார்த்தோம்னா கேர்ள்ஸ்க்கு தான் வரும். சரியா? autism ஓட கேர்ள்ஸ்னா ரெட்.
Okay, so now team B, Anuja and Sangeeta, you're left with options 1, 2, 3, 4, and 5.
4.
4. The upper limit of attaining walking alone milestone is, and your time starts now.
1 year, sir.
The teams can type their answers. Time's up, no more responses. So I think none of you have answered correctly. The answer for this question is 18 months. It is 1.5 years. Okay. So we have asked for the upper limit. So now team C, you are left with options 1, 2, 3, and 5. You can unmute. I'm not able to hear you.
3, sir.
Delayed eruption of teeth is considered if there is no teeth by dash age, and your time starts now.
Come idea இருக்கா?
யாருக்கு தெரியலையடா.
Sorry, your time's up. No responses after this will be accepted. So the answer for this question is 13 months or 1 year and 1 month. I think team D has coded correctly.
Team D.
So D are getting 5 marks for this. So now team D, Aparjita and Swati Bala, you are left with options 1, 2, and 5.
So option 5, sir.
How many weeks of therapy with ATT should be completed in a mother with active TB to initiate breastfeeding for the neonate? And your time starts now.
6 months. 2 weeks, sir.
Yeah, you are
More
right.
than 2 weeks.
Yeah, 2 weeks is accepted. That's the right answer. Okay. So I think we have come to the end of round 2. So we'll be shortly ready with the scores for round 2.
unmute பண்ணுங்க. unmute பண்ணுங்க. Mute பண்ணுங்க.
So at the end of round 2, Team A has scored 10 points in this round. So total cumulative is 20 points. Team B, 0 points in this round. So cumulative is 5 points. C, yet to open the account. Team D has scored 15 points in this round and total 15 points.
Okay. So now we have come to the round of end of round 2. So now we'll proceed to round 3. Again, this round also starts with Team A. It's on infectious diseases, vaccines, and neonatology. So Team A, Akshaya, you can choose your option.
The 4.
What is the minimum age for administration of influenza vaccine? And your time starts now.
Sir, 6 months.
Yeah, you're right. It's 6 months. Got it right. So you score 10 full points. So now for Team B, you're left with options 1, 2, 3, 5, and 6. Team B, Anuja.
6. 6.
6.
6, sir.
Yeah. For a baby with birth weight of 1.25 kg, volume of fluid required on day 1 is dash ml per kg per day. And your time starts now. Or your time's up. Other teams don't send the response after this. So
No one has scored.
I think none of you have scored it right. So the answer is 80 ml, 80 ml per kg per day. So that is for a very low birth weight baby. Okay, so that will be the answer for that. And now moving on to Team C. You're left with options 1, 2, 3, and 5. 2. Which disease in the neonatal period is characterized by elevated levels of PIVKA? So your time starts now. So your time's up. Other teams, don't send your response after this.
No. You don't.
So I don't think any of you have answered it right. So the answer is hemorrhagic disease of newborn. So what is PIVKA? Any one of you? Any team? You can just try. Any idea what is this?
Hemorrhagic disease of newborn.
Yeah, no. That is the answer for this. I'm asking you what is PIVKA? Any idea? No. So it's protein induced in vitamin K absence. Okay, so that is the expansion for that. And the answer is hemorrhagic disease of newborn. None of the teams have scored it right. Okay. So next, the last team for this round is Team D. You are left with option 1, 3, and 5.
Option 5, sir.
Which endocrine disorder can cause prolonged jaundice beyond 3 weeks in neonatal period? And your time starts now.
The hypopituitarism.
Other teams can start answering. So,
A, B, C has scored correctly.
so I don't think,
A, B, C has answered correctly.
yeah, A, B, and C. All the other teams have answered it right. So the answer is congenital hypothyroidism. Okay, so that is the answer for that. So that will complete our round 3. So we can just wait for a few seconds before our score is ready.
So in this round, Team A has scored 15 points, B 5 points, C 5 points, and D 0 points. At a total, Team
Sir,
A
we
is
told hypotherids.
No,
Hypotherids correct. 10 points.
which one?
The last question, hypothyroidism.
Last question.
That's a
Past question.
5 points.
Past question for you.
Okay, 10 points total.
No, you answered 2.
Yes, sir.
You answered only that question alone. You have answered right, I think.
No, sir. 11 and 16 chromosome number we also we answered. Total 10.
We
Total
are
10.
taking the total.
No, they are going to tell the total separately. Okay, so we just told this. Yeah. Scores for this round alone. Total, we will tell it separately. Yeah.
So at the end of third round, Team A total score is 35 points, Team B 10 points, Team C 5 points, Team D 15 points.
No, 30.
30 points.
So Team A is now leading with 35 points, closely followed by Team D with 30 points. Team B is standing third with 10 points, and Team C is with 5 points. So almost half the rounds of the quiz is now completed. So we have say 3 more rounds. So those who have not answered right, I hope you catch up with the further rounds that we are answering. Okay. So now wait a second.
Team D is 15 points only.
So 1 second, there is a slight corrections in this course, I think.
He
Can
did
we
not
say?
answer any question last round. I they repeat it.
So
Okay,
I
fine.
repeat the total points.
So total point is getting repeated. Just closely follow it.
At the end of round 3, Team A topped the ladder with 35 points, Team B 10 points, Team C 5 points, and Team D 15 points.
So Team D, your score is not 3-0, it's 1-5. Sorry. So now we'll be moving on to the fourth round. So this round again is going to be a round on systemic pediatrics. So now we will be starting with Team D. Okay, so Team D, you're going to select your options first. So be ready, Team D. Okay. So Team D, Abarjita and Swati Bala, you can choose your option.
So option 3, sir.
3. A 6-year-old boy with history of loose stools for 1 week now presented with an acute kidney injury and hypertension. The complete blood count showed thrombocytopenia and anemia. The peripheral smear of the child had cystocytes. What is the probable diagnosis? Your time starts now.
So question.
Wait a second.
Yes.
Yeah, your answer, please.
So hemolytic uremic syndrome.
Yeah, it's right. Okay, we accept this answer. It's the right answer. So you're getting 10 full points. Yeah. Just wait for a second. So now Team C, you are left with options 1, 2, 4, 5, and 6.
2.
2. 6-year-old boy with recent history of sore throat now presents with focal motor tics, attention deficit, and obsessive compulsive behavior. The possible diagnosis is
ADHD வருமாடா?
ADHD ஆனா இன்ஃபெக்ஷஸ் காசு இருக்குமா? ADHD சார்.
தெரியல எனக்கு.
ADHD.
Other teams, time's up. No one has answered. It's right. So the answer is pediatric autoimmune and neuropsychiatric syndrome related to streptococcal infection. So called as PANDAS. PANDAS.
They are given only streptococcal infection.
You are just written, I think.
Yeah,
They give.
So I think team A, team A, I think you have given the right answer. You will get 5 points. So now for team B, this Anuja and Sangeeta, you are left with option 1, 4, 5, and 6.
1, sir.
A 10-year-old boy presenting with herpes zoster and deviation of angle of mouth for the past 3 days. The possible diagnosis is. Your time starts now.
Facial outburns. Ramsay-Hunt syndrome.
Yes, you're right. It's Ramsay-Hunt syndrome. You get full 10 points. Team B gets 10 points. So now for team A, your straight question, you have options 4, 5, and 6.
5.
A 8-year-old boy presented with upper GI bleeding. On examination, he had splenomegaly, ascites, pallor, jaundice. Upper GI endoscopy revealed esophageal varices and eye examination showed some corneal changes. What is the most likely diagnosis? Your time starts now.
The non-cirrhotic portal hypertension.
Sorry?
Extrahepatic portal venous obstruction, sir.
Does anyone answer?
Anuja has answered correctly. Team B.
Okay. So team B, I think you have answered right. So team B, they have answered right. It's Wilson's disease. Okay. So that is the answer for this question, and team B have scored 5 points.
So in round 4, Team A has scored 5 points, Team B 15 points, Team C 0 points, and Team D 10 points. So at the end of 4 rounds, Team A total score is 40 points, Team B is 25 points, Team C 5 points, and Team D 25 points.
So now at the end of 4 rounds, team A is leading with 40 points, and team B and team D are 25, and team C, they have scored 5 points. So this is at the end of round 4. We have 2 more rounds. So now again, this round is going to start with team D, that is Abarjita and Swati Bala. So this is again round 5 here, systemic pediatrics. So team D.
Option 4, sir.
Option 4. Okay. So you have to answer 2 parts of the questions. So this round will predominantly contain questions with 2 parts. Only when you get both the options right, you will get the full marks. Otherwise, you won't get. Again, I will tell the answers right or wrong only when it is complete. Okay. So you can just give only one. You can just attempt it once. Okay. All others can start writing. Okay. And you can start texting it. So you have chosen option 4. Yes. Wait a second.
Yes.
Okay. Wait a second, I'll just share the screen. Okay. Name two dyselectrolytemia conditions
Sir,
that are
question
associated.
4, sir.
Yeah. This is the question. Name two dyselectrolytemias associated with prolongation of QT interval. And your time starts now.
Sir, so hyperkalemia.
Your time's over. Others.
Answer correct.
So team A and team B have answered it right. It's hypocalcemia and hypomagnesemia. Okay.
Oh. A only answer correct.
Sorry, I think only A.
A only answer correct. Hypokalemia and hypomagnesemia.
Okay. Team A has got the past question right. I think that is the only team that has got it right. Both the questions. Both the answers. Now, I think it's team C. Okay, team C, you are left with say 1, 2, 3, 5, and 6. I think we can leave off 1, right? You are left. Sorry, 1 second. Your option is 3. Okay. Name two differential diagnoses for ring enhancing lesions in CT brain.
neurocysticercosis ரா
neurocysticercosis
இன்னொன்னு hydatid cyst neurocysticercosis
sir hydatid cyst neurocysticercosis.
The other teams.
Team A.
Sorry.
Team A has answered twice.
Just wait for just seeing who has answered it right. The past question. First option. You take it.
So it will be marked.
So team A
And B.
Team A and team B. Okay, the answer is neurocysticercosis and tuberculoma. Okay, so that is the answer expected.
Sir,
Two teams have got it right.
sir, we also told the same answer, sir.
Your team
D, sir.
D.
Abharjita only two.
Yeah.
Anuja, Sangeeta, or Abharjita and
It's Abharjita.
Anuja term. Abharjita, tuberculoma, neurocysticercosis, correct. Akshaya, neurocysticercosis, tuberculoma, and toxoplasmosis. And Anuja, toxo, and neurocysticercosis.
The last one you don't get. You just can guess. I think you can give for Akshaya and
Akshaya and Abharjita. So team A and team D.
Team A
And D.
So A and D. You get it right. So now for the question for team B. Question for team B, you are left with option 1, 2, 5, and 6.
5.
5. So name any two parameters of the pulmonary function test that is used in the diagnosis of bronchial asthma. Your time starts.
Forced vital capacity, forced FVC, and peak expiratory flow. Forced vital capacity.
So that
FEV and FEC.
other teams can answer.
FEV and FEC, sir.
Time's up already, and I think other teams, your time's over.
Arnachalam, correct.
Okay, so I think yeah. So team A, you had sent multiple responses. Okay.
3 responses.
We have got 3 responses from you. So we are not validating yours. Okay. We got 3 responses from you. We asked you for only 1 response. 3 responses.
So only we repeated the question. Answer.
What is the reason?
So the exclamatory mark we gave question marks, so only we repeated the.
Yeah, but again, yeah, first option what you wrote, the first option you chose, that one was wrong. Okay, so we are giving this only to team C, 5 marks. Then now team A, your direct question. You're left with 1, 2, and 6.
So 1.
So you have to select the other 2. Okay, this has already been answered. So you are left with 2 and 6. Two and 6. Anyone among this? Answer? We're not able to hear you. 2. Okay. Name any 2 nutritional disorders that can cause left ventricular dysfunction, and your time starts now.
Vitamin E and the Mari.
Ventricular dysfunction.
Vitamin C, vitamin D, vitamin K.
Vitamin K and Kawashiorkor.
So Kawashiorkor.
Your time's up. Others also don't send after this.
C has the answer correct, and D has answered.
So the answer to this question is either you can write it as beriberi, carnitine deficiency, hypophosphatemia, hypocalcemia, or selenium deficiency. So any 2 among this would have been correct. Team C, Team C and Team D have answered it right, and they get 5 points each. So now that brings us to the end of round 5. So now we'll just wait for the scores for the round and the cumulative scores as well.
In round 5, Team A has scored 10 points, Team B 0 points, Team C 10 points, Team D 10 points. So total score, Team A 50 points, Team B 25 points, Team C 15 points, and Team D 35 points.
So again, end of round 5, the cumulative score, Team A still is on lead with 50 points, followed by Team D with 35, Team B with 25, and Team C with 15. So now we are entering the last round for this college round quiz. So it is on pediatric subspecialties. So again, we are starting with Team D. So Aparjita and Swati Bala, you can choose your options.
So option 3, sir.
2-month-old baby presenting with failure to thrive, hypoglycemic seizures, and the eye shows the following picture. What is the probable diagnosis? Your time starts now.
Galactosemia, sir.
Yeah, you're right. It's galactosemia. You get full 10 points. So Team C, your options are 1, 2, 4, 5, and 6.
6, sir.
2-year-old boy with history of recurrent blood transfusion since 4 months of age and on examination found to have splenomegaly and frontal bossy.
Thalassemia.
Thalassemia, sir.
Yes, you're right. So even before starting, you've answered it right. It is thalassemia, or we would have given it to you even if you have told it is a hemolytic anemia. So that gets you full 10 points. So now to team B, 1, 2, 4, and 5. Team B, Anuja. 4, right?
Sir.
A 4-year-old girl with history of fever and sore throat for 3 days developed vesicles in the hand, foot, and gluteal region. What is the probable diagnosis? And your time starts now.
Herpangina.
Other teams can type in their responses.
And Dexter.
So time up. Don't send your responses after this.
A and D.
Team A and D have answered it right. The answer for this is hand, foot, mouth disease. Okay. So that is the right answer for this. Team A. So last question for the day. Team A, you're left with options 1, 2, and 5.
1, sir.
A 12-month-old baby presented with hypotonia, delayed milestone, protuberant tongue, and constipation. What is the probable diagnosis? Time starts now. Sorry, so time's up. Other teams can send in your responses. Okay, so the answer, I think no one of you have answered it right. We thought it was a very easy question for you. So it's actually congenital hypothyroidism. Okay, so that is the presentation. You can even see my umbilical hernia in this child as well. So that is the answer for this. And so that brings us to the end of round 6 and the end of the quiz as well. So well played, all of you. So I think we need to give our scorers, a few more minutes to compile all the scores, and we'll get back to you with the final scores and results.
So at the end of round 6, Team A has scored 5 points in this round. Team B 0 points. Team C 10 points. Team D 15 points. So at the end of 6 rounds, the total score for Team A is 55 points. Team B and C 25 points, and Team D 50 points.
So I hope you know the results now, but I would like our HOD sir to come and announce the winners. So it was indeed a very good response from all of you. So it was it was a close contest between two teams. We'll tell you who they are, and now I'll call upon our HOD sir and Natarajan sir to share their views on this quiz and announce the winners as well.
Now our academic chief of pediatrics department, Dr. Naraj Ratnam, will announce the results.
So Team A, Akshaya P and Akshaya A is winners, and they will be representing this institution in the divisional round. Runners are the Aparajita and Swati Bala, Team D. For 5 points difference.
So it was just a very close contest.
Very close.
All of you will be given certificates.
All 8 of you will get the certificates of for participating in this IAP quiz program. And the main aim by IAP is that all of you should be interested in this specialty, and all of you should become pediatricians in future. So that is the aim of this particular quiz. So our aim is to admire all 8 participants and also we admire those who initially in the first selection round also many of them participated. So we wish all of you to become pediatricians in future. Pediatrics as your career.
Clap for the winners.
அதான் ஏற்கனவே போட்டாரு.
Thank you.
Thank you everyone for your active participation. And I have to definitely thank the quiz master. So when we are having a very tough time how to organize an online virtual quiz, so we need a lot of technical and latest technology supports, and Karthik sir really proved that conducting online quiz even with timer, everything inherent in the PPTs is possible. So a special thanks and appreciation for our quiz master. And also I should thank my colleagues. Everyone contributed to for getting the questions and in various aspects in conducting this quiz competition. I also thank the IT department and our hospital staffs who also lended their support in providing the other technical supports and helping us to stream it on YouTube. And now we will give the certificates for winners and runners, first and second place, and also for the participants. So we thank you all and hope you will prepare well the team who is going to represent our institute. Many colleges who are busy in COVID management, they are not able to participate. So you have to use up the time which you have to prepare well and do well in the coming rounds also. All the best. Thank you.
So we'll just share the final standings in the quiz scores. Okay. So So this is the final grand total of all your scores. So as I told you, it is participation that is what it is mattering. So one team has done well today. So see to that the winning team becomes, you are supposed to represent our institution. So I would like you to put in more hard work and prepare for the next coming rounds, which will be tougher than what we conducted today. And the other teams, I would request you to help the winners in preparing for the next round. And as I've already told several times, we are really happy with your interest for participation. So you're very overwhelmed with the response of 16 teams participating in the primary rounds. So we congratulate all the participants of today, and special congratulations for the winners. And we will be updating you on the subsequent rounds shortly. And I hope all your friends help you clear that round as well. So that brings us to the end of our IAP quiz today. So I hope it was a good experience for all those who participated and all those who viewed it as well. So I'd just like to have a feedback on the session from the participants itself. So Aparjita, your comments. Was it easy, tough?
Medium.
Medium. Okay. What about Arunachalam Kamalakannan?
Medium.
Medium. Okay, fine. So I think preparing for this quiz, you must have gained some knowledge, right? So that will definitely go a long way in helping you write your final exams and your entrance exams as well. So what about Anuja, Sangeeta? Okay. I think Sangeeta is not, video is gone. Okay. Anuja, just tell your response. What you felt about today's quiz. How was it? I think her connection has some problem. What about Akshaya?
Medium, sir.
Medium. Okay, fine. So we would like to create a group for sharing the questions and all the other academic inputs so that the winners are getting trained in a better way. So I hope this quiz would have made you orient towards many of the aspects. Your subsequent rounds will be more tougher. And for others who have participated today, definitely this preparation and whatever we discussed today is definitely going to help you in a long run. Okay, so with this, I would like to conclude, and we are just closing this session. So we'll update you on the further details shortly. Okay. Thank you all for participating, and best wishes for the winners. Thank you.